I like that I get to relate to the patients. I get to know who they are, find out about them, why are they here, what brought them up to Alaska in the first place. They like the outdoors, they like hunting, they like fishing, and some of the problems they're having really restricts what they can do. It affects their ability to enjoy these things that they came to Alaska to do in the first place, and that we're able to offer a simple service that can fix that.
Because everybody here is here because they care about people. We want to see people healthy and happy.
Their lives improve, and it's like they feel like they're really enjoying and living what they came up here to live.
After meeting Dr. Nima, knowing that their problem has been solved, they've got a way to take care of it, whether it be male issues to something that everyone experienced at some point in time, like kidney stones.
Not everybody wants to come to the urologist. We do our best to make them comfortable, feel welcome, and address those medical needs.
To receive top care, to have their problems taken care of and handled so that they don't happen again.
Patients are looking for an answer. They're looking for medical care. They're looking for a solution to a problem. They're not looking for something that will continue to drag on. They're not looking for, well, let's try this or let's do this. They've got a problem, they want to fix it. And they've come here to see a specialist because that's exactly what this practice does. They specialize in fixing these problems.
I think patients want to be healthy because they know that when they're not, it sort of consumes their lives. You know, they can't work, they can't be at home, they're suffering from pain. And, you know, when that happens, nothing else matters, it seems.
I think the most important thing is for the patients to know that we're here for them. We're here to help bring them back to where they were before the incident or before the kidney stones or prostate issues. And they need to know that we are here for them.
Understanding what their problems are, what they feel is a problem, understanding their concerns and addressing them in an empathetic and a sympathetic manner. And not just addressing them like, yeah, I understand you have a problem, but it's addressing the problem as we're fixing the problem.
They feel like they're understood, that they are heard, and the doctor acknowledges that. We all acknowledge that the problems they're going through, that they get the help they need.
Helping them understand what affects their problem and what other effects it may have, and educating that feels like it empowers them as a patient for their own health care.